I will record it.
Okay, so hopefully everybody can see my screen. So my name is Calvin Grenowig, and I am the Director of Risk Management for Sequoia Living. I am a registered nurse. I've been with the organization now over 9 years. I've got a critical care background, open heart background, and I owned and operated my own assisted living facility with my family for a number of years. I also worked for an insurance company and traveled across the country doing on-site evaluations for long-term care, assisted living, memory care, and independent living sites. Then I got recruited to NCPHS, which is now Sequoia Living. So I've been doing risk management for a little over 17 years now. And I'll let Ray, and my partner in crime, I'll let Ray introduce himself.
Thank you, Cal. Appreciate the introduction. Ray Bodewin, I'm Director of Facilities for Sequoia Living. Been with Sequoia Living for about going on my 15th year. And prior to coming to Sequoia Living, I was Director of Operations at a psychiatric hospital, as well as a firefighter for about 28 years. Did that concurrently. And I'm currently on the California Health Facilities Disaster Advisory Board for the state of California, and a former member of OES, Office of Emergency Services, with the Mayor's Office in San Francisco. So got a little background, and my duties pretty much cover emergency operations as well as capital improvements and disaster training for all of Sequoia Living.
Okay, so let's see. So we have, today we're going to talk about the COVID vaccine. We have two presently that are on the market that are available, the Pfizer and the Moderna. And each county in the state of California has been given the approval to basically determine how the vaccine is given, to whom, and to how many doses, and began the process of rolling out the vaccination. They initially planned to do all of the high-risk people first, which was any of the acute care areas, skilled nursing facilities, staff and residents that live in those areas, then move to assisted living and memory care. Independent living were going to be later in the process. However, some counties are shifting that process just a little bit and doing things a little bit differently. I'm pleased to say that Sequoia Living, we have already vaccinated a number of residents at Tamalpais, and we're in the process of vaccinating the rest of the independent living residents soon. Most of the staff have been vaccinated, and at Viamonte, our new building, we have vaccinated all residents and staff, except those that haven't moved in yet. And Portola Valley, we have vaccinated the staff and residents in the health center and assisted living and memory care, and they're in the process of doing independent living soon, probably within the next week. And at San Francisco, they have a vaccine clinic going on already today to do all the rest of the residents and staff. They initially did the skilled nursing and staff in those areas. And then they're going to be adding today to their vaccination clinic, the home office, and some social workers. So hopefully we'll soon have most of our sites vaccinated, which we're very excited about. Healthcare workers, acute care, and EMS obviously are in the first tier of the vaccination process. And the general public will be later in 2021. However, I've just been listening to the governor speak, and they're in the process of bringing in more individuals to help with the vaccination process. He wants to speed the process up because of this huge surge in which we're in right now. So they are bringing in nursing students, they're getting a hold of dentists, they're pulling a lot of people out of retirement, and other healthcare practitioners are also working a lot with EMTs to increase the vaccination process. So Ray, I'll let you talk about the two vaccines on the next two slides.
Sure. So the coronavirus vaccine, the first one is Pfizer. And emergency use authorization was submitted. Obviously, it passed through the FDA. What's really nice about this vaccine is that it is 95% effective. That's very important. There are two doses, which are spaced to 21 days apart. They have to be maintained at a very, very low temperature, and that's the reason for the delay in getting those vaccines out to all the different counties. Once you get the vaccine, if you get a Pfizer vaccine, you have to get the second vaccine, which would be the same, which would be a Pfizer vaccine as well. There's only one vaccine brand that could be used actually per person for both doses. And the vaccine, when it's sent out to each of the sites, is maintained in a special container, and they use dry ice and or special refrigeration. It depends on what type. The other thing about this vaccine, and actually this type of technology, including Moderna's, is that this has actually been used now or studied for different uses for the past 10 years. So it's not something that was developed just this year. This was developed a while ago, and now they've used it for the first time with a vaccine portion. But prior to that, it was used for cancer patients and cancer treatment. Next slide, please.
And just real quick, the reason we're getting the Pfizer vaccine in this area is we're one of the sites in California that have sub-zero ability. So we have a couple acute care medical centers that have it. The Buck Center in Marin has several sub-zero refrigerations. So Northern California is getting a lot of Pfizer vaccine, which you may possibly get.
The Moderna vaccine, much the same process. It did go through a little bit longer time to get approved. The FDA hearing was scheduled for December 17th, and obviously it is approved and it's being processed. The percentage of effectiveness is 94%, which is very similar to the Pfizer. Once again, you have to have two doses. This time, instead of 21 days apart, they will be 28 days apart. And again, if you do get the Moderna vaccine, because it is possible that you can get it in Northern California, you would still have to get the second dose as a Moderna. The refrigeration requirements are a little bit less stringent compared to the Pfizer, and they could refrigerate up to 30 days. So it's very important that they distribute this vaccine as soon as possible, once they get the dilution rates. Next slide.
I know, Ray, you received the vaccine. Any concerns that you experienced?
No, the only thing I did have was a very small headache, mild in comparison to anything else that I've ever had. Mild headache that night. My left arm was a little bit sore, but that's typical when you receive any type of vaccine. I did check with my doctor prior to getting this administration, and I think that's important for everybody to do. So before you get clearance, make sure you check it out with your primary care physician. I did, and he gave me the green light. In fact, he encouraged me. He says, if you get the opportunity, please take the vaccine. So I was very happy to get it. I really had no side effects. I stayed for 15 to 20 minutes after the shot. I didn't even feel it really actually going in. Very minimal issues at all. It was an easy process.
I agree. I too had the opportunity to get the Pfizer vaccine. I'm heading into surgery, unexpected surgery. So I checked with my primary physician and the surgeon, and they said, yes, by all means, if you have the opportunity to get it before, at least the first dose before surgery, please do so. So I have the first dose. The second dose I will receive after I'm out of the hospital. So I too had absolutely no side effects whatsoever. Didn't even have any pain in my arm. For a brief second, thought I was going to have a headache. And just as I was thinking about, I might get a headache because I rarely get a headache, it disappeared. So I feel absolutely great, very, very happy, and would definitely recommend people to get it.
One thing,
So,
Cal, if I can just add,
sure.
the other thing is that the numbers that we're getting with this current surge on top of a surge, it's really important that you do look into getting the vaccine if it is offered to you. It is something that, the mutation that everybody is talking about, they have done studies, and the new vaccine, this vaccine, the one that's currently out there, will handle those mutations. So the coronavirus has mutated about 8 or 9 times since the beginning of the pandemic, which is back in February of 2020. So this latest variation, it looks like this vaccine will handle that.
Yes, that's correct. So the vaccine comes in basically sort of a kit. It has the needles, the syringes, the alcohol preps, and the face shields, so that the folks giving it have a safe barrier. Facilities' responsibilities is to make sure that they have enough dry ice in the event that they need more, gloves, Band-Aids, sharps containers, and hand sanitizers. So really, it's a really nice kit that comes from Pfizer, already prepackaged, so allows for easy distribution on our end. Ray, I'll let you go over this one.
Sure. So what are the signs and symptoms or the concerns? Basically, you can have pain where the shot was provided in usually your left arm or your right, depends on which one you prefer. They will ask you, it is shot in the upper left or the upper right. You will have possible fatigue, some headaches, usually minor. There may be chills associated, possible fever, possible joint and muscle pain. But all of these could be really, so far, have been proven to be temporary, transient in nature, and easily, covered with over-the-counter, either Tylenol or Advil. But once again, talking to your primary care physician, you'll know what you're going to be able to take and what your limitations are. Some people have more issues with what they're taking than the vaccine. So pain once it's where the shot is, it is all normal to be expected. If you do get this vaccine, these side effects that you're going to get possibly are all normal. They're all associated with the shot. It's actually a good sign to have those.
And I will say, one of the other questions we get a lot is, I am hesitant to take it because I don't want the live virus. This is not the live virus. RNA is basically mimicking what the virus looks like. So the body thinks, oh, I'm getting this virus attacking me. It starts building up antibodies to basically fight it. So that's why you may get some of the symptoms. Again, Marin County put out a report this morning that less than 0.5% of the people they've inoculated have had any symptoms. So it's really a small dose of anybody that's having any sort of symptoms. What I'm hearing from many people that have got it, they have kind of a groggy feeling for a day or two, and then after that, they're fine. If anything, some, as Ray said, some pain at the injection site, but within 24 hours, it goes away. There have been some people across the country that have reported on the second dose, the symptoms get elevated. However, at the Tamalpais, those that received the second dose, no one reported any symptoms, side effects at all. So that's great news.
Yeah. The other thing is that it is possible that it can last, these are averages that we're getting. It is possible that you could have these feelings, possibly the headache, the fatigue, and those things could last for 24 hours to 48. It's not something that is written in stone that it's going to last X number of hours. So it could stretch out a little bit longer than 48 hours. It all depends on how it's administered and how you react to it. So there's no real time frame with that.
So again, you've already heard FDA has approved both those, and the distribution has already occurred. We anticipated this around December 14th and 21st, and we're pleased to say that active clinics are going on right now at all of our sites and have been scheduled. Affordable housing, we hope, will be scheduled soon. So that will be the last of vaccination of our residents. What we're finding is that there's a lot of mixed feelings about taking the COVID vaccine. Should they do it? They've read stuff on Facebook, they've read stuff on the internet. A lot of misinformation, unfortunately, is out there. So we've been spending lots of time educating staff, educating residents, different PowerPoints, different presentations like we're doing now, being available to answer questions, and obviously also vaccinating by leadership. So we're showing that our CEO, everything down to our managers and many of our departments are taking the COVID vaccine as well. So we've been educating staff that way. And just basically being available just to answer questions one-on-one if they want it. The other questions we're getting a lot about infection control. Will we still have to wear a mask? Will we still have to social distance? Can our practices go back to the way they were years ago? And the answer right now is no. You will continue to wear a mask. You will continue to social distance. You will continue to wash your hands frequently. You will continue to do all the practices until we know that globally most people have been vaccinated, and then we will see what happens and what changes come into play. But at this point, all of the counties have been very directive and very clear that our current infection control practices will remain. Ray, I'll let you do this one.
Sure. So when will independent residents receive the vaccine? So right now, there's really not been any date. It's really up to the counties. As soon as they deploy. Now, sometimes we'll get a notification, and I'm giving you one of our communities was notified, I think at 4 o'clock on a Monday, that they'd like to come and vaccinate everybody on Wednesday. So the timing of these vaccines is really kind of depends on the county. So that's my advice to you is to get your questions now while you've got the time before you get notified to your primary care physician, so you can at least have those things out of the way. It's really important for that because you may only get 24 hours to 48 hours notice that you're due for or scheduled for a vaccination shot opportunity. So once that comes, make sure you take it because it's they don't come back really, really quick. Once the residents and staff are vaccinated twice, will the rules change for more socialization, dining room, et cetera, activities? So we're going to have to see what the next steps are. Cal mentioned earlier that we're still going to have to follow all those protocols. Just because we're getting the vaccine does not mean that you cannot wear a mask, that you can't wash your hands, that you're still going to have to do social distancing. The mutation that is with the current coronavirus is very, very, it's actually more infectious than the original coronavirus. So you really do have to take all the steps to make sure that you stay with that. How long will we have to wear our masks? And we're kind of going over this again because this is a recurring theme. All staff and residents are going to need to wear their masks. You're going to have to social distance. In fact, they're asking people, instead of staying 6 feet away, they'd like to have everybody move to 10. And also not a cloth mask, but using a filtered type of mask. So if you want to wear a cloth mask over the filtered type of mask, that's fine too. But it is something that you really want to take your time with and make sure that you do cross-contamination. We could go over that with you at another time if you wish.
Okay, so it looks like some of the questions in the chat so far have more side effects been reported on the second dose. That varies. What we heard earlier in some people on the West Coast or East Coast that had received the vaccine, that they had more symptoms on the second dose. We're experiencing so far minimal symptoms on the second dose. Actually, at Tamalpais, those who received the second dose had absolutely no side effects. So it could vary just based on the individual, but so far we are not experiencing that many on the second dose. Does either vaccine contain the virus? And the answer is no. It does not contain the live virus as in the past. In addition to the Buck Institute, where are other Northern California storage centers? My understanding is UCSF. My understanding is Kaiser Medical Center has some cold storage capability. I'm not sure of anything else beyond that, Ray, unless you've heard of anything.
UCSF has a site, San Mateo County has a site, Stanford University, John Muir Hospital in Walnut Creek, and the Buck Institute, which actually has a very large cryogenics unit, is handling pretty much Marin County. So those are additional sites that have it.
Okay, the next question, Ray, I'll let you address. What does the effectiveness percent mean? 95% of what, for example?
So to kind of break it down, and Cal will probably have to tag team this one a little bit, but when you had the regular flu vaccine, depending on which, they're kind of taking a guess as to which one, A or B. And it was pretty much 62% effectiveness, which meant that you had some protection. It doesn't mean that you're not going to get the flu. It could mean that when you get the flu, it's just not as bad as it was. So with a 62% effective, which was with the flu vaccine, this was prior to the vaccines, that was actually really good numbers. The fact that we're getting to 94 and 95% is phenomenal. And that means that you have an excellent chance of, if you did get COVID, that it would not be as bad as if you didn't have the shot. So it's really a very effective, a very high number. The efficacy on this program is really, I mean, it's excellent. I mean, I was happy with 62 to 70%, but the fact that they got to 94 and 95 is unheard of. It's really a first.
Yeah, I think it's important to know that vaccinations, the government feels that a vaccine development of 40% or higher is a good vaccine. The fact that we're at 94 to 95% is amazing. So there were absolutely no shortcuts in development of this vaccine. I think that's really clear to send that message. No shortcuts. Why this was developed so quickly was twofold. One is the government prepaid development cost to make this vaccine happen, and they prepaid for distribution, getting it started at the same time, getting all the wheels in motion, which is unheard of. Most vaccines, you start the process of development, then you have to go through the approval, then you have to go through how you're going to distribute it. That's why there's years in the making of this. But the government basically set these wheels in motion under Operation Warp Speed, which was one very good thing that happened throughout this pandemic.
Yeah. And this is a global effort. This is not just the United States. I mean, this is something that has been a global effort in providing this vaccine. So
right, there are about 3 other vaccines coming on the market, probably first quarter of 2021. Johnson & Johnson is developing one. They're also trying to develop a low-cost vaccine because several third world countries, they're worried about not being able to have the funds or resources or the refrigeration.
Yeah.
So they're trying to develop a vaccine that can go in a standard refrigeration so that it's easily deployed.
That's the AstraZeneca.
That's right.
Yeah. So AstraZeneca.
And that's going back through some more studies because of different issues that came up during the initial phase of trials.
Yeah. And it's really important to know that this vaccine really has been in development. You know, it's not new science. This has been around for a good 10 years or longer. And it's just really just been modified just a little bit to be used as a vaccine instead of a treatment, which they've been using this ongoing for cancer patients. And it's been very successful.
Okay, so the other question in here is, will you send the clinic to subsidized housing? The answer is we're going to, as we have done throughout this pandemic, we work with our public health partners, the state agencies, our county agencies, and we have to educate them. Early on in the pandemic, they did not even think about affordable housing. So we have done lots of education with them. So it is our hope that, yes, we will have a clinic directly on the sites of our community outreach programs, but we don't have the direct answer yet. But we are working diligently with them. I've even recommended that we use that site to vaccinate some of the seniors in the general public, because those sites are large. They're able to accommodate several people, socially distance. We have the same thing with one of our affordable housing properties up in the woods up in Northern California. We've actually recommended maybe they come to that site, and the folks that live in the regional area can come get vaccinated as well. So as soon as we know, we will share that information. But rest assured that all of our partners we're working very closely with. Are the staff getting the Pfizer vaccine? The answer is yes. So far in this area, we have been receiving the Pfizer vaccine, and we anticipate that to continue. Is N95 mask considered a filtered mask? What else is, Ray? I'll let you. Yep.
Sure. There's all different types of masks that are out there. The N95 is a very good mask. However, you have to be fit tested to use that mask. It is also something that you need to get a doctor's clearance to wear. So caution when you're using an N95. What you probably want to use is, or what I would recommend is a filtered mask, which is a 3-layer mask. You could buy those at Walgreens, CVS, Costco, Amazon.com. Those are the types of masks that, you just slip them over your ear. It does not require a fit test, and it does provide you with some very good protection. One of the key things about putting on the mask, though, is when you put it on, you want to make sure you shape it around your nose. So you start at the top near your eyes, but don't touch your eyes. And then you're going to push it around your bridge of your nose so you can get a very good seal. And then make sure it goes underneath your chin. And you wear that over your nose, covering your mouth, and then underneath your chin. And then once you take it off, make sure that you wash your hands prior. And then when you take it off, dispose of the mask, and then wash your hands again, because the mask is theoretically contaminated. So you want to make sure that you do that and change those once they become moist. I don't know if that answers your question.
Next question is, do you have to get a doctor's okay to get the vaccine? The answer to that is really no. But that being said, if you have any concern, any health condition, diabetes, any immune response system, any severe allergies, we do recommend that you check with your primary physician to make sure that it's okay. All of our clinics that have been open also have an EpiPen in the event that somebody does have an allergic reaction. But that being said, again, if you are questioning at all whether you should have it, do check with your primary. And to Ray's point, when he said it earlier, check now, because again, when we hear a clinic is going to be operational, we have typically less than 2 or 3 days to turn documents around, get things ready. So we won't have time for you to be calling your doctor, trying to get an okay then. So work now at it if you have any concerns whatsoever.
The other thing I wanted to mention before I forget, and this is important, is once you get the vaccine shot, they're going to give you paperwork. You're going to get a copy of whatever consent form you signed. That'll be for your own personal records. And then the most important thing is you're going to get an immunization card. That card is your ticket to get the next vaccine. So once you get that card, number one, put it in a safe location. Number two, take a picture of it with your phone if you have the phone available. That's something that way at least you have a record, because in case you lose that document, it would be difficult to get the second shot. So it is something that you might want to consider.
Yeah, and please take heart on that. We've already had 2 staff members, even though we said, take a picture of it, hold on to it, put it in a safe place. They put it in a safe place. They can't remember where they put it. So again, taking a picture, taking a photocopy of it is a great idea. We're also telling our staff to make it part of their employment record at Sequoia Living, so that in the event they do lose it, this will be an annual thing that you'll have to basically have available.
Yep.
When will Aquatic Park members be allowed to receive the vaccine? Again, we don't know, but as soon as we know, we'll share it with you. We're working with our public health partners to keep them informed and make sure that we have dates available and space available. What are the protocols for administering the vaccine on site? How can the vaccine, how long can the vaccine be out of cold storage? Who is managing administration of the vaccine? Again, this is done all with our public health partners. They have the protocols, they monitor it, they bring in the vaccination teams. What they've asked for at some of the sites is some of our staff to help monitor staff, because once you receive the COVID vaccine, you are to be monitored for 15 minutes. Unless you've had ongoing allergic reactions or other reactions to vaccines, then you may be 30 minutes. So they've asked some of our staff to be the monitors. They still have nurses and doctors in the area that if somebody's having a problem, you know who to turn to right away. They've asked some of our staff to help with registration, kind of check-in process, but they're taking care of all of the monitoring of the vaccine, making sure that it comes out of the cold storage in time, using the agent to reactivate it, all of that good stuff. So again, that is really done at the public health level. When notified to take the vaccine, we must see our own doctor. The answer to that is, again, if you feel like you are in question of whether you should take the vaccine, talk to your doctor ahead of time. But once you've had the vaccine and you've had the second dose, I then would alert your primary physician that you've had it and give them a copy of the record so they have it. If we need surgery, would you recommend one should get the vaccine early opportunity? Yes, I do. Since I'm going into surgery on January 20th for an unknown or unexpected medical issue, I did reach out to my surgeon. I did reach out to my primary because I'm concerned about going in the hospital with the surge going on right now, but I can't wait for my surgery because it's affecting my ability to get around. And they recommended, yes, get the first dose as soon as you can. And so if you are in need of surgery soon, I would recommend you check with your primary physician or your surgeon and try to get it if they advise you to do it as soon as possible. How long does the vaccine last? Again, it looks like we're going to be having annual vaccination clinics unless they are able to develop a vaccine that would be lifetime. Right now, that's too early to tell. Any contraindications for a vaccine like asthma, any medications that would conflict? Who will notify me when I can get the vaccine? Will centers be easily accessible without a car? All very great questions. Again, if you do have asthma, I would check with your physician to see. Most people that have asthma, emphysema, COPD are being recommended to take the COVID vaccine. And who will notify when we can get the vaccine? Again, as soon as we know if we're going to be having a clinic at one of our sites, Aquatic Park or one of the others, we will definitely send out a message and let people know. We would prefer to do the clinics on site, obviously, so it's easy for people, but we don't know exactly when or how that will happen. Will there be a certificate or something to acknowledge that the vaccine has been given? Ray's already answered that. Yes, there's a vaccination card. Again, we do recommend you take a picture of that card or a photocopy of that card and store it in a safe place, but remember that safe place that you put it in, because that's sort of your ticket to the future for vaccinations. So, will the vaccine be made available to family members of staff? Unfortunately, that will have to happen when the general public is being vaccinated. So right now, the process has been to vaccinate our staff for those who are caring for seniors, caring for the vulnerable residents. And so it's only available for staff. It's important to give is it possible to still give the virus to someone else when you are vaccinated? I heard that you can still infect others. Ray, you want to address that one?
Well, you have the possibility of being asymptomatic. So that is something that, they're going to have to look at. So monitor your signs and symptoms. If you feel any subtle change, you should really be checked out and have a COVID test. So you could get a PCR test at CVS or Walgreens or Rite Aid or Project Baseline. And usually you get your results within probably 2 to 3 days. It does take a little while. There are some that are instant tests, but they are less reliable. But it is something that once you do get the vaccine, it's a little too early to tell what's going to happen with that. I think that this is it's something that they're going to be learning about. But if you are asymptomatic, it is possible that you can pass it on to others.
So that raises another great thing that I didn't put in the slide. So you will be encouraged to sign up for an app on your smartphone. This is a process where the CDC and others are studying the side effects for a period of time. So this app will allow you to enter any side effects that you're having, and it's automatically reported to the CDC and other scientists who are studying this COVID vaccine right now and monitoring for symptoms. It's a period of, I believe, Ray, correct me if I'm wrong, at least 6 months after you've had the vaccine that they will be monitoring for symptoms and side effects.
That's correct.
So we really do encourage, again, everybody to sign up for this. The app is free. It's again, we're trying to learn globally how folks are reacting to this virus. What notification method will be in place for seniors in general? I'm not sure what you're looking at for this question.
Well, I think that I can answer that one a little bit.
Okay.
I think as you're all on this call, and you were notified by Sequoia Living to set up. So being part of a community is going to help you. When we hear of something, I noticed that the town that I live in just set up a notice for the entire town to be on a call this coming Wednesday to give information on the vaccine. Now, what that information is, I'm not sure exactly. So there are alert systems, but as soon as we know of something that would, that you would be available to take the vaccine, we will definitely pass it on to Crystal and Janet and and Frank. So we want to make sure that you get that along with Gina to make sure that everybody gets that information as fast as you possibly can. But being part of the community, Aquatic Park and other sites, part of the community services, you're going to get that information. As soon as we know it, you'll know it.
So the next other question is stronger side effects with the second dose. Again, what we're hearing from some parts of the country is that, yes, some people do have side effects with a second dose. We've experiencing so far that the side effects are minimal if the second dose is given or none whatsoever. Next question, once the Pfizer vaccine is thawed and diluted for use, it must be used within 6 hours. Yes, we're very aware of that. You indicated that the vaccine administration will be handled by public health and representatives, but my understanding is that CVS is actually administering. Well, that's not correct. We did sign up for CVS distribution, but right now the public health has been directing giving the vaccine at most of our sites. However, that being said, CVS is now reaching out for second and third location vaccination clinics so that people that missed the first one will be able to still get the COVID vaccine.
And
So
the CVS staff have been trained on administering this vaccine. So they've been going through special protocols, how to dilute, how to make sure that it stays refrigerated, et cetera. And they're coordinated with the county as well as the CDC.
And the other part of this question is, are Sequoia medical staff and directors overseeing the process? We're not necessarily overseeing it, but we've been intimately involved with every aspect of it, setting the clinic up, making sure that our protocols are followed when they're on our site, and being very, very involved. And yes, we are all making sure that we follow CDC guidelines on the vaccine. So this has been a long time coming. Will the vaccine maker make you test positive? The answer is no. Getting this will not make you turn positive. I, again, received the COVID vaccine last week, and I actually had a PCR test on Saturday, and I'm negative, and I have to have another one next Saturday. So far it's been negative. And again, I'm testing on a regular basis because I have the possibility of being deployed into a building and help our sites. Okay, there is one question from somebody who couldn't attend the meeting today. According to the announcement that the governor made several days ago, priority list requires that the first recipient after the first responders, and according to some reports, prisoners of the vaccine over 75 or of color are given the vaccine. Yes, those 75 or older were supposed to be in the next phase, but I did hear today that they're trying to ramp that up, and they're looking at lowering the age to 60 so that they can vaccinate more people globally. Again, this is changing every day, every minute of the day. So as soon as we have more information, we will let you know. But I anticipate as, again, we have more people to help with the vaccination process, we will be able to do this a lot quicker and get more people vaccinated. It is a bit of a struggle when you try to think about global vaccinating people globally. It is astronomical when you think about it.
Yep. So the bottom
All
line
right.
is, as many people get the opportunity, if you get a call that you have an opportunity to get the vaccine, make sure you check with your primary care physician today. You know, I would place a call today, so at least you can get that out of the way, because you might not get the answer for 2 to 3 days from your doctor. Sometimes it's not as easy as we'd like to get in touch with your primary care physician. So ask the questions now, which allows the time for the doctor to review your case properly before they give you permission to move forward. So that's something that you can do right now in anticipation of this next step. And hopefully we're going to get those things soon.
And again, you know, the timing of this is, we hear CVS calls us or the public health calls us and says, Cal, Ray, or who's ever at the facility, we want to do one in San Francisco Tuesday afternoon from 1 to 4, and we need to know how many doses you need, and are you going to be ready? We need this answer in 48 hours. And that's about the amount of time that we have. We have to get consent forms. We have to get all the information of who hasn't been vaccinated, what their date of births are, all this information. So again, we really do encourage you, if you have any concerns about the vaccine, reach out to your primary physician now, get those answers so that when you receive a call, you're ready to go. Because again, there's limited time to turn this around.
The other thing,
when we, oh, sorry. The next question was, when you hear about the second dose, will we be notified? Absolutely. So as soon as we have that confirmed, we will notify everybody. Again, we don't typically hear that till after the first clinic is done. Then they begin the process of setting up the secondary clinic, and they give us a date. We're due it this day or this day, and then they confirm that usually within a week. So as soon as we know, we will communicate to all of you.
And I was just going to
Go ahead,
mention
Ray.
that from a Sequoia Living point of view, we would not be promoting anything that we thought was in any way a danger. But once again, we don't know all of your health histories and everything else. Only your doctor, and you know that. So talk to your doctor, but we would definitely not promote anything that would cause any kind of imminent danger to you. So we're definitely on the positive side of administrating this vaccine.
Absolutely. And we feel extremely confident that this is safe. Otherwise, we wouldn't be promoting it. Ray and I have done tons of research on this. And again, this is such an amazing feat that it's happened so quickly. And we're so appreciative that we've had the opportunity to work with our public health partners so closely and provide this vaccine to our staff and our residents as timely as we can. So I think that answers all of the questions, unless there's, looks like another one's coming in maybe.
We can also take a verbal question if you feel like it and you don't feel like chatting.
So for the second dose of the Pfizer is done 21 days. Is it okay if, yeah. So typically it is 21 days. Sometimes it's day 22, maybe day 23. Again, a day or two is for either one of the vaccine is not that big of issue. They try to get it as close timing as they can, but it also is a logistical issue. When you're looking at vaccinating thousands and thousands of people in a county, yeah, it may be that it's 22 days as opposed to 21 days. It won't be necessarily sooner, but it could be a day or two later. All right, Crystal, we'll turn it back to you. I think we've answered everybody's questions unless there's something that the team has.
Anybody else have a question? Speak now, or raise your hand, or say what you need.
Charlotte has a
Okay.
question. Charlotte. Unmute Charlotte, please.
Okay, sorry. I may speak for others, but I appreciate your candor. When somebody asks a question, you're not quite sure of the answer, you say so. You say,
Absolutely. I'm not gonna bullshit you because I don't want to do that.
well,
So
because there are so many half truths floating around.